Hey, Jim Hoffman here for EMS Office Hours and your Monday Minutes, and we're continuing on with our EMS Quick Study Help and Quick Study Tips, and this is episode 30. As we delve a little further into poisoning and overdose, this is assessment part of it, part 3, where we're talking about specific poisoning agents or overdose agents and your assessment and some basic treatment for them. Of course, I always tell you that this stuff is important, guys, and it's not just because you're looking to help you on exam, right? The content that I give out on these quick study tips are designed as things that you will see most commonly on EMS exams, right? But if you don't understand it, you have a question on or need clarification, you can send me a question, of course, or you can look in your textbook, go online and do some research, or use an online resource, something like TurboMedic. Also, can all help you build your knowledge base. You understand the concepts of what I'm speaking about a little better. Okay, so this is why it's so important. It helps you with your patient assessment, helps you with your presentation, your documentation. All that ties in together. Okay, so let's talk about today's, and we're talking about types. And today we're going to be kind of a quick presentation talking about narcotics and opiates. Right, we see these a lot in the field. Things like heroin, morphine, fentanyl, codeine, oxycodone, hydrocodone. These are some common things that you'll see out in the field. Keep in mind, I've recently had a lot of elderly patients who present with either a change in mental status or they're unresponsive. And the last thing you really expect an elderly patient to be having problems with, right, is overdosing on something like hydrocodone or something like oxycodone, right? So a good patient assessment, looking for a history, looking for the medications, should all lead you into the fact that they might have overdosed accidentally on one of these drugs, because they've got a lot of pain, maybe back pain, maybe arthritis, things like that. So, some symptoms you're going to be looking for, euphoria, of course, if they are awake. But when you're talking about patients that are having issues where they're calling us, most of the time they're unresponsive. So you're going to see that respiratory depression, respiratory arrest, or even cardiac arrest at times, depending on how long they've been in respiratory arrest, right? Hypotension, look for those constricted or pinpoint pupils, right? Them being in a coma, even seizures, and also nausea. Okay, all things to look for when we talk about a patient that might have overdosed on one of those previous, on an opiate, okay? How do we manage these patients? Well, of course, we have our circulation, our breathing, our airway, or our ABCs, and watching out for those, right? Many, many times you might see some paramedics and some providers out there who will say, no, we don't need to give them Narcan. We just need to use our BVM and make sure that they are still breathing, right? We're helping them breathe, right? Because they're in respiratory arrest or respiratory depression. Okay, but a lot of agencies and your protocols will tell you to go ahead and give Narcan. Now, Narcan, I've noticed over the years, used to be you would give them a full 2 milligrams to begin with. Now it's more of a titrating thing. We don't want to wake up that patient too quickly. Okay, which is why the note here, right? You're going to antagonize the narcotics themselves, right? And they're not going to be too happy if you wake them up very, very quickly, right? So a lot of protocols nowadays nationwide, they start with giving 0.4 milligrams of the drug, and you kind of titrate to effect where they're breathing on their own. You don't necessarily have to wake them up altogether, right? You want to get that respiratory drive going. So sometimes just getting that respiratory drive up is enough, okay? But of course, you want to follow your local guidelines and what your med control wants you to do. With dosage-wise and route-wise, right? Now, talking about the route, well, IV administration is very popular to do, but it might wear too fast, right? Like I said, make the patient wake up too quickly. So a lot of agencies want you to do IM injection instead, okay? This usually lasts a little bit longer, and the patient will wake up more gradually, more slowly, okay? Nowadays as well, you can give this medication via IN, intranasally. Okay, some med control docs prefer that to even IM or IV as the first choice of administering this drug. Okay, to kind of reverse that opiate. So that's pretty much it, guys. I don't have too much more on this topic. Again, pretty straightforward, right? You follow your circulation, your airway, your breathing. follow your guidelines when it comes to use narcotics. And if you haven't, you're in an area that is allowing their firefighters, the first responders, or police even to give Narcan before your arrival. Find out how much they give, what route they gave it. Okay. So next time we're going to talk about toxic gases. Okay, and talk about that and how that relates to poisoning and overdoses and different types you might see in the field, some management tips and signs and symptoms. Okay, so we'll do that next time. Guys, as always, please connect with me on these social media outlets here. I'm on Instagram, I'm on Facebook, I'm on Twitter, and I'm also, of course, on Snapchat. So any of these links here will take you to my page where you can go ahead and follow me and friend me on these social media platforms. I'd love to see you there. I'd love to interact with you. I really enjoy doing that. So please hook me up and friend me or follow me on any of these mediums. I hope you can use these Monday Minutes and these quick tips, guys. If you have any of your own, I'd love to hear them. Love to go ahead and maybe create a special Monday Minutes based on your suggestions. So send them over to me. My email is contact@emsofficehours.com. All right, until next time, guys, as always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.